Okay, I'm going to do a artery blood gas analysis, and what I would do first is check the patient's chart, making sure that there's an order for an ABG in there from the doctor, and I'll go and introduce myself to the patient. Um, I'll make sure that I have the right patient by asking their last name and their birthday, and then I'll go ahead and ask if it's okay if I go ahead and take a blood sample from them, explaining to them that it's a little bit different than a regular blood draw that the nurses would do. This one's going to be from the artery, so the first thing I would need to do is just check their wrist and see if they have good collateral return for the puncture to happen. So once they said that would be okay, I'll wash my hands, put some gloves on, and go ahead and perform the Allen's test on them. And once I see that they have good collateral return, I'll go ahead and get my alcohol wipe and prep the area, making sure that it dries off. And then I'll get my syringe. I have a 23 gauge needle here, and I'll take the cap off, making sure that the needle doesn't touch anything. I'm going to pull back the syringe to 1.5 milliliters. I have that the bevel is facing upward, and so I'm going to hold it like a pencil and insert at, first of all, I have his wrist up on a towel to make sure the artery doesn't roll away from me. So I'm going to insert at a 45-degree angle. Okay, here we go. 1, 2, and 3. Insert the needle and watch the blood fills up. Once it's all filled, I have my gauze already prepped and ready. I'm going to go ahead and take the needle out, keeping the needle away from me. I'll go ahead and cork the needle. And I'm going to hold pressure on the artery for about 3 to 5 minutes. I'm going to get my bandage and go ahead and place it on the patient. Now with my sample, I'll go ahead and take off the needle, and I'm going to cap the syringe, making sure that's nice and tight. I'll examine my sample, ensuring that there's no air bubbles or anything. I have my biohazard bag here already. I'm going to send the sample. I had already previously filled out my patient label, name, I took the patient's temperature, and room number, date, and time that I took the sample. I have that all set, and I'll send that off to lab. Go ahead and take off my gloves and wash my hands.